Good morning, Leah.
Good
I'd like
morning.
to welcome you, Mrs. Leah Ntoa, to our interview at St. Patrick's today. Leah is a pharmacist at Link Pharmacy at Pick and Pay, and she's also a parent at the school. So it's a wonderful opportunity, Leah, to talk to you today about medication, pharmaceutical stuff, what's happening in the pharmaceutical world because of the COVID virus. So welcome to you. Leah, we're talking about the winter season. Um, what products, given that we're having quite a cold winter, given that COVID is around, what products would you as a pharmacist be saying to parents, listen, take these, it'll help with your resistance, and so on? What kind of things would you say?
I won't really be specific on the the actual manufacturers or
Yes.
anything like that, but we recommend that each and every person must have vitamin C at home, um, zinc, as well as vitamin D.
So
As
those
we are sitting
supplements.
out here in the sun, it's good. We're getting vitamin C, so and also immune boosters.
So vitamin C, vitamin D, zinc,
Zinc,
and
yes.
immune boosters.
Yes,
Yeah.
and for affordability purposes, you also get the combination. Most of them have combos where you get one,
So you don't
one.
have to buy four
Yes,
different products.
yes, exactly.
You
You'll
could
find
get
that
them
whatever that you want, maybe in another product, you get your vitamin C. You also get your zinc, and then maybe vitamin D. But with the patients that have tested COVID-19 positive, obviously the dosage is going to be higher. But for us, for prevention, it's good to always have that lower dose.
Okay, that's interesting. So you've raised 2 points there. Take a combination of those
Mm.
vitamins to help you improve your
Immune system.
immunodeficiency.
Yes.
And secondly, if you have actually been sick with COVID,
Mhm.
you're going to take a great deal more to help you recover.
Yes,
Yeah.
that's how it is.
Okay.
And just to add on that, in terms of affordability, obviously we're catering for different classes of people.
Yes.
They are all available from the lower price, medium price, and obviously more expensive stuff.
Okay. So
Yes.
that's good to hear. So
Mm,
it doesn't mean if you're a bit cash strapped that you can't get the medication.
exactly. Yes.
So you can get another product which you can afford.
Yes.
Okay, well that's very
So
good to
so
hear.
at least when clients go to our stores, they can actually request whatever they can afford, because we know the pocket is very bad at the moment.
Yeah,
Yes.
yes, no, I understand that. Tell me, you got any other tips for the public about boosting immunity?
I'd start with the whole hygiene scenario before the actual tips, because what we want to enforce is that we sanitize, wash hands, clean the surface all the time in our pharmacies. So with everyone, they must just do as they are told by the government.
As the
Yes,
president said.
yes,
Yeah.
yes, yes. So the tips that I can give for people is to make sure that they obviously exercising. I know the gyms are closed, but a walk wouldn't hurt. Just a
Walk, a
mild,
jog.
yes, and
Mm.
a jog, and then also eating healthy foods. Obviously, when you say healthy foods, you need to have your protein, your carbs, and yeah,
Your
your
vitamins, your
fruit.
vegetables,
Yes,
and so on. Yeah.
exactly.
Mm.
Yes.
So those are
So
two things that you raised there: additional exercise to boost your immunity,
yes,
and eating properly, correctly every day. Yeah.
yes. And another thing that I can recommend is the use of humidifiers. We keep humidifiers that can actually, for each family. For example, you can buy a mini size or a big uh, humidifier where you can put in eucalyptus oil. The use of eucalyptus oil is quite broad, but we know that it unblocks
Passageways,
yes,
yeah.
yes. So you just put it in there with water. There's a guide in that humidifier. Then you just plug it on and
Is
the
that for
mist
people who are
goes.
sick, or you should be using
Everyone,
it
I would
anyway,
recommend it for everyone because personally I'm using it at home. Yes,
just as a
yes.
standard thing?
Just as a standard thing because you need
Mm.
to get inside to after you've done everything from work. When you get home, you do your own procedure and then it's already circulating around. Yes.
Okay, wow, that I certainly haven't heard before. And then the last question from my side, Leah. You know, parents do from time to time fall behind with their annual, you know, immunity injections, the BCGs, and this, that, and the next thing. Should they be doing it now, irrespective of COVID, or should we be waiting to catch up on our jabs once COVID has receded a bit?
I would say it's not a nice thing to expose the kids to the immunizations. There is no rush. There is a procedure that we have that has been given by the Department of Health. It's not something that came up now.
Yes.
It's something that we've always done for people who are late on immunization. So we wouldn't want to expose, even though our procedure with us at the Link Pharmacist is that when you want to come and immunize your child, we have to pre-order the items and then you can come and without following a queue.
So as soon as you've got the order in, the
we,
patient gets called and they come in.
exactly, yes.
Okay.
So we can do it that way, but I don't recommend it 100% because there's a cash up immunization. We can always cash up rather than actually taking kids and exposing them. You never know.
So let me understand this. Are you saying if they've fallen behind, don't suddenly rush in and try and get it all done at the same time?
No.
Nope.
No,
Just
I wouldn't recommend it.
you would
honestly.
not recommend that.
When the peak is a bit lower, then
Okay.
we can start and yes.
Okay, so rather wait a few months and then come and catch up.
Yes.
Okay, that's good advice. All right, Leah, is there anything else that you would like to tell our listeners? Stuff that you've learned with this pandemic that's perhaps important?
Yes. As I said, our motto is to make sure that the stock is available all the time. We tried and tried and tried, but the stock is available now. I still don't recommend someone to come and just take the whole shelf in the store of vitamin C and
You mean in the
yes,
fear they're going to run
at
out?
least yes. At least come once or twice a month so that others can get because we don't
So
know
no
what to
stockpiling.
do. Yes, no stockpiling at home because it also you'll run a risk of having expired stock as well because once this is over it's another issue. It's
So you
not
mean it
like
could just
these
sit?
products are dangerous. No, they are not. But to say let's have everyone getting everything.
Yeah.
I mean, we need to also get. So if you are taking and taking a lot, then it's selfishness. Also, in terms of finances, we are not equal. I understand, but at the end of the day, it will pose a lot of danger in terms of the crisis financially, either for the pharmacy or you as well as a client. You see?
No, I do understand that. I can see there's a knock-on effect all around.
Exactly.
So effectively what you're saying is that a patient or client should come in and buy for the month.
Yes.
And not stockpile for 6 months
Yes.
or whatever it might
Yes.
be.
Let's
I'm with
say,
you.
for
I
example,
understand that.
it's your patient who has underlying diseases. If you have underlying diseases, you come once a month. Then you come and stock up on your vitamins and extra things that you want so that you don't get exposed to anyone. Yes. And also I would also advise the clients to try and communicate with their families. Once you test positive, or maybe one of the members of the family is testing positive, you need to test. And then after testing, I would say it's more of a psychological thing. Because if I'm here and I stay with my granny and she tests positive, I need to support her. Even if it's a call, if you are away, it's a call just to support somebody. I personally have had somebody who is in my family who had tested positive but does not stay in Coxted. So I had to make sure that I call her every day just to encourage them, because the more you stress
support,
about it, moral support is very important, and they must not take it as if it's something bad.
Stigma,
yeah, they mustn't stigmatize it. It must just be like that. Yes, support all the way.
So yeah, otherwise loneliness creeps in, and you feel you're fighting it by yourself.
Exactly.
No, I get it. Good.
And also a recommendation that people who are in quarantine must make sure they follow the rules.
Follow protocol, yeah.
Yes, they must make sure, because for you to be running around, because what I've learned in the pharmacy is that people just come, and they would come while they are within the quarantine period, and then that is danger to society. Yes, to the whole community. So if you are positive, it's okay. We're getting prescriptions, for example, now from the doctors locally, sending people with the same vitamins I had spoken about. Yes. So you need to make sure. If you don't feel like, let's say, for example, I'm in quarantine and I need something, we do have our Facebook pages, we have our numbers everywhere. So people can call in for deliveries.
So they don't actually have to come into the
They
pharmacy.
don't have, more especially if it's
quarantine.
exactly.
Yes.
Yes, because it's a free delivery, but only within the CBD.
Yeah, I think that the rules for quarantine, if you've tested positive and if you've got close contacts in the family, are very clear. You need to make a plan for someone to go and do your shopping for you.
Exactly.
Phone into the pharmacy for your medication, get it delivered. I mean, I think that's all becoming much clearer as the disease advances. So, Leah, is there anything else you'd like to say?
I would just like to say people must take care of themselves.
Yeah.
You
Start with number one.
Yeah.
Yeah.
Take care of yourself. Make sure that whatever that you are doing, uh, keep distance, social distance, and also, as I mentioned, exercise, eat healthy. I doubt you can be susceptible that much if you are doing those things.
Doing the basics properly.
Yes,
Yeah.
if you do it properly. So, yeah.
Well, yeah, thank you very much for joining us today.
Thank you.
I hope this has been some comfort for you to come out of the pharmacy, enjoy the sunshine and the discussion, and certainly it's going to be worth broadcasting it. I think there'll be a lot of people interested in what you have to say.
Yes.
So thank you very much.
Thank you for inviting
And
me.
it's a pleasure, and have a good day further.
Thank you so much.